Hi friends, this is Dr. Shri, and today we'll be talking about the keyhole surgery, which is widely known as minimally invasive surgery, or we also call it as laparoscopy. That is, what is it? What exactly is laparoscopy is? If you take the olden days, people used to do a open heart surgery, which requires more time, and the scars on it is pretty wide comparatively with a laparoscopic surgery, which is a modern technique that allows the surgeons to operate inside the body using very tiny incisions, usually under 1 centimeter. So this is the big advantage of the laparoscopy surgery. And second thing is, like we spoke before, the stay at the hospital is very less, and the blood loss is also very less comparatively to the open with the open type of surgeries involving whether it's a small area or large area. Instead of opening a large area, surgeons really use a tool called endoscope, which is got a tiny camera in the front, which is flexible, and they do a real-time view of the internal organs onto with a video monitor, and then they insert the surgical instruments through other small incisions to perform the surgery while watching the screen. So in this process, what happens is mostly like your appendix, abdomen, or pelvic surgery. Doctors use carbon dioxide gas to gently inflate the area, create a safe working space for the instruments. So the surgery time depends on the type of the surgery, and the healing time is also less. There is a faster recovery time and shorter hospital stays, and if you talk about less reliance on pain medication. And scar wise also there isn't much, so it is kind of smaller and noticeable scars, low risk of complications, avoiding excessive bleeding. So while highly successful keyhole surgery, I wouldn't say it again depends. When we surgeons recommend patients for keyhole surgeries, it depends on their physiology, the current medications and the current conditions, whether they are good candidate for the keyhole surgeries. So depending on that, a surgeon may convert it into the traditional open surgery, depending on the patient's safety. So, and then you might be wondering, what are the general knots that those are used in keyhole surgery. So talking about the knots, the 4 primary surgical knots are square knot, surgeon's knot, granny knot, and slip knot. And there's also Mishra's knot. While the square knot is a gold standard for most closures, so variations like the surgeon's knot are used for high tension areas. And talking about slip knots, they are frequently used in minimally invasive or laparoscopic procedures. So when you are talking about knots, and building block of all surgical knots are like half-inch or throw. And when we are talking about the 4 types, they vary based on how these half inches are combined, wrapped, or tied. So when we are talking about the square knot, which is mostly used knot in surgery, they are formed by 2 successive half hitches tied in opposite directions, and the second throw locks the first to create a flat, secure knot that will not slip. So these are used basically for standard closures and ligating, tying of blood vessels where tension is manageable. Now coming on to the surgeon's knot, which is highly secure variation of the square knot. So here what happens is, the first throw involves passing the suture material through the loop twice before tightening. That is a double throw followed by a single opposite throw in the reverse direction to lock it. That is how it is done. And what is the surgeon's knot used? Surgeon's knot are best for high tension wounds or tissues that tend to pull apart, as the first double throw creates or very good for extra friction, preventing the suture from unraveling while the next throw is placed. Then you have the granny knot. So what is this? These are tied incorrectly by looping the suture 2 times in the same direction. And because the throws are identical, the knot slides very easily, lacks structural integrity, and is generally considered as a surgical error actually. So it's best for inadvertently tied or intentionally trying avoided usually, like it should be actively avoided in surgery due to high risk of slipping and causing wound disease. So let's come on to the slip knot. So this is, what is a slip knot? A knot. This is a knot where one end of the suture slides freely along the main strand, allowing the knot to be pushed down tightly against the tissue from a distance before it locks into place. It's basically used in all laparoscopy, endoscopy, or minimally invasive surgeries where it becomes difficult to manipulate the suture by hand inside the body, and a secure external tie needs to be advanced. So the 4 basic knots which we were talking before are the ones surgeons frequently use, and Aberdeen knot, so often used at the end of the continuous intradermal stitch. It is a self-locking loop knot that eliminates the need for bulky traditional knots on the skin. And then you have the strangle knot or constrictor knot, which is basically used specifically to permanently and securely occlude the larger vascular pedicles during like a spray procedures. So here we spoke about the best surgeon's knot, like the gold standard if you're talking in the surgical procedures. They are more secure. Let's talk about the flat square knots, which are more secure, where there is a risk of tearing a suture through delicate tissue. And the square knot is another type of flat reef knot with a single overhand knot with a reversed overhand knot on top. So now we know what are the basic knots. So now you might, some people have a doubt can surgeons knots are usually, why is it used? It's usually used in tying medical sutures because the double knot design tightens against itself, ensuring that it will not come undone. So this is one thing about the knots we were talking about. So then there is one question arising in patients generally. What they ask is, will a knot be permanent? Once the knot is done, will it remain permanent? So knot is permanent. When a patient asks whether a knot is permanent, it depends entirely on what kind of knot you are referring to. So physical knots such as a overhand knot or a tangle in hair are never truly permanent, They are theoretically always be united or kind of brushed out. Though extremely tight knots in rope or heavily, it again depends what it is. Not like here I'm explaining about rope, cord and general hair for people to understand, like when you're talking about surgical, I think it depends on the type of surgery, what are the type of sutures that we do. Surgical sutures can be classified into mainly 2 categories. One is observable and another is non-observable. So again, observable and non-observable sutures, even if you go to dental surgeries, they have observable and non-observable sutures. Again, they are classified into another four types, primarily types, and depending on the material, like there are natural absorbable and synthetic absorbable, natural non-absorbable and synthetic non-absorbable. Now you might be wondering, Dr. Shi, what is this synthetic absorbable sutures? So synthetic absorbable sutures, talking about them, they are designed to be broken down and absorbed by the body over weeks or months. I mean, you need not physically come to us to get it removed. So it's completely eliminating the need for physical removal. Once they are put, it will fall off by itself within weeks or months. So this is like up to say like polydioxanone, like PDS, that provides like a long-term tensile strength, say up to 6 weeks, and is ideal for slow healing tissues. Then you have Vicryl. So it is like a galactine 910, a braided synthetic material. This is used for deep and subcuticular closures. And then you have Monocryl, a monofilament synthetic that glides smoothly and is commonly used for skin closures, after a surgery is done. So when you are talking about a natural absorbable sutures, these are biological materials that the body naturally degrades. So catgut, so derived from the intestines of healthy mammals like sheep or cattle. What happens, sometimes it is sometimes treated with chromium salts, chromic catgut, to slow down the body's absorption rate. Then you have synthetic non-absorbable sutures. So when you are talking about non-absorbable, they don't fall off. You have to be physically present for us to remove the knots. Like these threads are made from synthetic polymers that the body cannot break down. So they offer permanent support and are typically used for external skin closure or in areas requiring long-term unyielding support. So mostly like it's made out of nylon. So a very popular inert monofilament widely used for standard skin closures is nylon. Then you have proline, which are highly inert, extremely strong, so frequently used in cardiovascular and ophthalmic surgeries. Then you have polyester ethibond. This is a braided multifilament suture that provides long-term durable tissue support, which is often used in orthopedic and cardiac procedures. Now coming on to natural non-absorbable sutures, which are derived from natural fibers and which is used for long-term or permanent tissue approximation. Though these are well known to elicit a higher tissue reaction than synthetics. Silk is often used in general surgery and in dentistry. Braided silk is extremely soft and easy to handle and ties excellent secure knots. Then sometimes there is stainless steel, sometimes grouped separately. This metallic non-absorbable suture is highly stable and which are commonly used in orthopedic bone closure or sternal closures. So with this, I'm going to end up today's video on keyhole surgery and the type of suturing that I was talking about. So I wish you all a healthy life. Thank you for watching and God bless.